Mental health disorders in adolescence. I chose this topic to help spread more awareness. Adolescent mental health pertains to the psychological, emotional, and social welfare of individuals. It includes their capacity to manage life's difficulties, foster positive relationships, engage in effective learning, and participate actively in their communities. Some of these disorders are emotional mood disorders, behavioral disorders, eating disorders, psychosis, suicide and self-harm, and substance abuse. Emotional mood disorders may include depressive disorders, which encompasses a wide range of conditions characterized by persistent sadness or loss of interest. Bipolar disorder includes several types involving mood swings between mania and depression. PMDD is premenstrual dysphoric disorder, a severe form of premenstrual syndrome with intense emotional and physical symptoms. Treatments can include medications and therapy. Some medications might be antidepressants or antipsychotics or mood stabilizers. Types of therapy could be CBT, which is cognitive behavioral therapy. It focuses on identifying and changing negative thought patterns and behaviors. Dialectal behavior therapy, DBT, combines CBT techniques with mindfulness to help manage intense emotions and improve relationships. Psychodynamic therapy explores unconscious thoughts and past experiences to understand current emotional struggles. Behavioral disorders may include ADHD, attention deficit hyperactivity disorder, ODD, oppositional defiant disorder, CD, conduct disorder, DMDD, disruptive mood dysregulation disorder, IED, intermediate explosive disorder. Possible causes could be genetic predisposition, early childhood trauma or abuse, inconsistent or harsh discipline, family conflict or parental mental illness, learning disabilities or neurological conditions, exposure to violence or neglect. Up to 5 to 10% of children and adolescents have some form of behavioral disorder. Boys are more likely to be diagnosed, but girls may show different symptoms. Early diagnosis and intervention greatly improve long-term outcomes. Eating disorders qualify as anorexia, which is a restriction of food intake, intense fear of weight gain, distorted body image, bulimia, binge eating followed by purging, and a sense of loss of control. Binge eating disorder, frequent episodes of eating large quantities of food without purging. Avoidant restrictive food intake disorder, or ARFID, is extreme pickiness or avoidance without body image concerns. The factors could be biological, psychological, sociocultural, environmental, and family. Ages 12 to 18 years, girls are up to 13 to 15% may experience some form of eating disorder. Boys, estimated 3 to 5% may experience an eating disorder. Binge eating is the most common eating disorder in both genders, but more often reported by girls. Early onset schizophrenia, schizoaffective disorder, bipolar disorder with psychosis, major depressive disorder with psychotic features, brief psychotic disorder, substance-induced psychosis, and psychotic disorder due to varied medical conditions are some of the psychoses in adolescence. Suicide and self-harm. Suicide is the second leading cause of death for 10 to 24-year-olds in the United States and is a global public health issue. Suicidal ideation, thinking about or planning suicide. Suicide attempt, engaging in potentially fatal behavior with intent to die. Completed suicide, death caused by self-inflicted injury with intent to die. Suicide and self-harm, understanding self-harm. Definition of self-inflicted harm. Example, cutting, burning, hitting, without intent to die. Purpose, often used to relieve emotional pain, express distress, or regain a sense of control. Not a suicide attempt, but increases risk of future suicide attempts if untreated. Around 12 to 15-year-old girls are approximately 2 to 4 times more likely to engage in self-harm behavior than boys. Treatment types: dialectal behavior therapy, family therapy, medication, safety planning, hospitalization, and support and education. Substance abuse encompasses risky consumption of psychoactive substances such as alcohol, tobacco, cannabis, prescription medications, and illegal drugs, which adversely impact one's physical, mental, and social well-being. Mental health challenges are rising among youth. Early intervention is critical. Supporting youth mental health is not just a priority, it's a necessity for the future of our communities.